So I think yes, 100%. I think the year 2023 is the year, I would say, for low-risk MDS, because we have a couple of phase III trials which have been reported, and some of them, I would say the majority, have been positive, some of them have not. But I would like to mention actually two clinical trials. Number one is the COMMANDS study, which got recently published, where actually the study investigated a head-to-head comparison, EPO versus Luspatercept, in treatment-naive, low-risk MDS patients being red blood cell transfusion dependent. And the primary endpoint actually was met, so a superiority was actually observed for Luspatercept versus the so-called old-fashioned EPO therapy, which I think is a major achievement, also a rather large trial, including a great number of patients. And to make a long story short, I will, of course, talk about this in my presentation. This trial was the backbone for the FDA to decide whether Luspatercept label could be extended to first-line therapy, and FDA actually did. So a couple of days ago, FDA approved Luspatercept as a first-line therapy for all comers, low-risk MDS patients being red blood cell transfusion dependent, which I think is very good news for our patients. The second trial is the IMerge trial, Imetelstat versus placebo in patients failing first-line EPO or ESA-based therapy. This trial also met the primary endpoint, so Imetelstat was superior compared to placebo in the high transfusion burden patient population, which was included into the trial. This drug is also filed for FDA and EMA approval, but the jury is still out whether this will be the case. Apart from this, I would say also a negative large phase III trial was reported to be negative with an HIF inhibitor, Roxadustat, which also brought some interesting data and results. Again, the study has not been published, but what we know so far is that the trial did not meet the primary endpoint. So yes, I would say very important year for low-risk MDS patients.